A useful facility in Health One or any program when dealing with risk factor management or chronic diseases is to be able to case find patients as we work through our daily list. Now, while analysis will provide you with a point in time description of who may have a particular risk factor or not in your practice, or perhaps who has not had that risk factor checked in your practice, the advantage of the alert function with Health One is that on the fly, as you consult, Health One will conduct an analysis to establish whether or not the particular patient that you're about to see has a deficit in terms of their screening. So for a case-finding approach, probably the configuration tool is the most important tool in Health One. So if we have a look at that by opening this, clicking on this icon here, the parallel program that runs in the background to Health One called the configuration tool is opened, and within it we can open the manage alerts function. And here you'll see that I've already defined an alert called find BP. To create a new alert, you click on the little plus sign in the bottom left-hand screen, and you define the alert in this dialog. Now, I've already done this for the blood pressure case finding, and I'm going to edit this alert now using the little pencil icon, and we'll just talk through what's present. Here you'll find that we've given it a name called Find BP. We're going to jump down here just to define initially when this analysis will be operational. And what we're saying here is that we only want Health One to conduct this analysis within the file when the file is opened. There are some situations, perhaps, when you want to be alerted to a patient who has a history of drug abuse, that you might want to tick more of these options so that every time the file is manipulated within a consultation, you are reminded of that particular risk. But in the situation where you're just trying to be reminded that somebody hasn't had their smoking status recorded, or in this case, their blood pressure recorded, it's sufficient to select this option. So this option tells us to run an analysis when the file is opened, and here's the analysis predefined for us, which I've set up previously. We're looking at adult patients. We've included test patients, but they can be excluded, and we're including private and GMS patients and patients of both sexes, and we've defined a mini analysis within this dialog called systolic blood pressure exists. And if we just edit that using the same pencil icon, you'll see what that looks like. It's very like a database analysis dialog, and you'll see that it's asking us, Health One is asking the file, has this patient in a date 365 days from backwards in time from today's date, have they had the item systolic blood pressure recorded? And how that's done in Health One is a little bit counterintuitive, as it is in any software program. You have to define that the systolic blood pressure content exists, and then you have to leave this box unchecked. If you leave it unchecked, the alert will trigger when this condition is not satisfied, i.e. the alert will only trigger when systolic blood pressure is not recorded. If that's then saved, and we leave this function altogether and go back to the patient file and look at one of our test patients here, we'll find that this patient had a blood pressure recorded this year, and therefore the alert did not file. If we delete that entry and save the file and reopen it, we now see that we're being reminded to check the blood pressure. It's important to note that if you're not in the headspace for doing this kind of work, you can switch these alerts off. And you do that within the Health One configuration tool by unchecking the enabled box.